is Abdul Wahid from the Maldives. Well, I was diagnosed in cancer in February 8th, 2023. And the very reason I have to do this is I'm a swimmer who goes to swim, and I was hit my chest in a barrel and the pain did not release. So I went to the doctor after 10 to 15 days and he took an x-ray. And after the x-ray he said, "Dear Wahid, I see something else in this x-ray. Well, I think it is cancer or tuberculosis." And he waited for 5 minutes. He sent his x-ray to somebody. And after 5 minutes, he had a call and he told me, "Wahid, it seems it's cancer." So I felt very sorry for that. And he asked me to take an immediate CT scan. So the other day I took a CT scan and it was diagnosis for cancer. And I was asked to go for my insurance. It's called Asanda. So he gave me the letter for Asanda and I applied for Asanda. And Asanda had given me opportunity of coming to India. And the Asanda gave me Cochin Manipal Hospital. So I told Asanda, well, I'll do a test on Google, what is the best hospital for cancer. So I researched for 2-3 days and I found HCG hospital is the best hospital according to patients' remarks. So I asked Asanda, please change me to HCG hospital. I came to HCG hospital and I asked in the counter, what is the best doctor I should meet for cancer? And by the same time, I met a Maldivian lady here who's a friend of mine called Aishat. Husband was admitted here. And I asked her, hey, who is the best doctor for oncology? And she said, okay, please go to Dr. Naseer. He is one of the best here. Even my husband is treated by him and he's doing well now. So I got appointment the next day to Dr. Naseer from the international counter. The international counter was so helpful for us. The following day, I met Dr. Naseer.
Hi, Mr. Wahid, who is a 65-year-old man from Maldives. He actually came to us with complaints of mass in the lung. So initially, we evaluated with a PET CT scan and did the biopsy. And we came to a conclusion that it is a type of lung cancer called adenocarcinoma, and it is belonging to stage 3 according to the classification. So at this moment, we at HCG we have a tumor board meeting, which is called as a multidisciplinary tumor board meeting, where we discuss about each and every patient and plan ahead how we have to go about the patient. We at HCG we believe that recent advances are also very important in the management of patient, and in this topic we have something called as immunotherapy. Immunotherapy is a type of medication which enhances the immune system in body to fight against cancer cells. So in stage 3 lung cancers, there is a recent advance where we have to incorporate immunotherapy in the management, and we did for Mr. Wahid. So we added immunotherapy and chemotherapy. After the initial phases of the therapy, we did a PET CT scan. So otherwise, we would have got a very less response with chemotherapy alone. With addition of immunotherapy, we had a very good response with significant regression in the disease status. So later, he underwent surgery, which was a robotic surgery, and the surgery was very well done with any evidence of any microscopic residual. So this was also facilitated by significant regression with the addition of immunotherapy earlier. Post that, patient completed radiation therapy, and we continued the maintenance therapy of immunotherapy for almost 1 year. And at the end of 1 year, we have done a complete evaluation of the patient with a PET CT scan, and radiologically there is no evidence of disease on the PET CT scan. And we have also done something called as circulating tumor cells, which picks up abnormal tissue or abnormal cells in the peripheral blood of the patient. It's a blood test where we can pick up the abnormal cancer cells in the blood. Even those circulating tumor cells, CTC, we call it as, are also negative. So both radiologically as well as in the blood, we don't have any evidence of cancer.
Well, after the result, I am free from cancer, and I thanks God, Allah, that I had been free from cancer, as well as the doctor's team, and also to the international counter who helped me a lot in my difficult periods, especially Satish and Miss Bhavana. And Satish is a very nice person who helped me in my difficult periods. Even if I am in emergency late night, even in midnights, if I call him, he used to come to the hospital and help me in emergency.
This is an important message. What I want to convey is that recent advances and recent developments are very well required in the management of cancer patients. And with this principle behind, we added immunotherapy and we have got a very good response. And Mr. Wahid is doing very well.
Well, I'm free from cancer, and now I'm working as a representative of HCG Hospital in the Maldives to help people of cancer in Maldives. And I have a special thanks to Dr. Ajay Kumar, the chairman of this hospital. I met him. He was so happy to see me, and he is grateful that I was cured from cancer, and he is so thankful to me, and he's such a nice person. It's lucky that I met him. It's not a every Maldivian cannot meet him, I think so. Well, thank you for the team, and thank you for everybody in the hospital.